Now, to an extent, it already happens. Many major trusts already have private patient units that plough back any profits into the NHS. For example, Great Ormond Street received £20 million from private patients in 2008-09, and it now has a dedicated international patient centre. This is something we surely want to encourage as more providers become foundation trusts. I take a similar view on outbound care. NHS organisations are already offering their services abroad, often in partnership with private sector organisations. Sometimes it is for straightforward commercial reasons. For example, Moorfields Eye Hospital in Dubai treats thousands of fee-paying patients out there every year, returning £2.4 million to the NHS in 2008-09. Sometimes it's also in the interests of philanthropy. Addenbrooke's in Cambridge, for example, is working with a hospital in Botswana to improve HIV/AIDS treatment. I can't see why we cannot increase this kind of activity, not only for profit, but also to build up the NHS's reputation abroad. Frankly, why shouldn't our top hospitals be competing with the likes of the Harvard Medicals and the Sloan Ketterings of this world? This should be the scale of expectation we have for the brightest and best in the NHS. But as much as selling our clinical services may catch the eye and make the headlines, it shouldn't detract from the wider opportunities that are available. In fact, direct provision of NHS care is only a small part of what is possible. It's actually NHS consultancy and know-how that offer the biggest potential revenue streams. That's because NHS organisations generate tremendous amounts of intellectual property as they design new solutions. Data packages on health and lifestyle activity, drug cost benefit, clinical trials, tools to support commissioning, quality accounts, or service failure protocols, and the various accreditation processes, social marketing campaigns, and telecare models, which you can see all around us today. These have a direct application elsewhere. All of this has huge interest and commercial value for other healthcare systems. We believe that the products, the knowledge and systems developed by the NHS could be worth up to £150 million a year in the global market. Are we harnessing this expertise or realizing the value in a systematic way? The answer, in my view, is not enough. By the same token, we all agree that the NHS is home to world-leading clinicians and healthcare experts, and there's huge demand from international organizations or governments looking for advice and consultancy to help them improve their own healthcare systems. For instance, the National Institute for Health and Clinical Excellence have already provided advice on replicating the NICE model to numerous countries in Europe and the Middle East. Across the whole NHS, the potential revenues from advisory services could be as high as £200 million. So again, are we really doing as much as we could? There's no question in my mind the NHS can compete with the very best in the global market in all of these growth areas. And that's why I'm so pleased that this expo looks outwards as well as inwards. Yesterday I had the pleasure of opening the International Business Innovation Zone, the IBIZ, and I met delegations from various countries from around the world, all of them looking to partner and buy from British companies. And from the conversations I had, the NHS doesn't just have a chance to compete. In many cases, it can be the partner of choice for many health economies. But you may say, do people really want a more commercially aggressive NHS? Is it really part of what the NHS should be about? Well, there will always be some, I'm sure, who claim that this is somehow selling off the family silver. But I think more people would say that at this time of economic pressure, we should encourage entrepreneurship and enterprise within NHS organisations. Of course, the deal breaker for the public would be if commercial activity was ever at the expense of frontline services and patient care. But do let me be clear, that has never been on the agenda and nor will it be. All of us agree that improving care for NHS patients must always be the first priority, and that will never change. But if we can achieve more value from NHS expertise, then this money could be ploughed back into the UK health system, as it already is in some of the pioneering trusts. In fact, going back to the Moorfields example, its chief executive, John Pelly, has said, and I quote, that without profits from commercial business, our ability to invest in our clinical services would be seriously constrained. So this isn't something that will detract from patient care. In many cases, it's actually vital for improving it. We know that this isn't an easy time for the NHS. It's arguably the toughest time in its 60 years of existence. But you know what they say about necessity. It will take strong, forward-looking leadership. But this can also be an exciting and empowering period of NHS history. Innovation, as Andrew said yesterday, can be decisive in meeting the financial and demographic challenges. And we need to champion this work as a way of delivering more for NHS patients in a tougher climate. But let's not stop there. I think we can and must harness NHS expertise and talent to much better effect as a commercial opportunity, to build our international reputation, to draw in more investment and resource from abroad, and to reinvest in patient care. That's my message. There's no doubting that the talent is there. Certainly the opportunity is there too. So let's make the most of it. Thank you very much.